If you're like most folks Dr. Kris Fusterhausen works with, you're active, you want to take ownership of your health, and you want to age gracefully. The problem is there is so much conflicting information out there about health and wellness, it's tough to know who to trust. Most providers are limited by what insurance will approve, so it can seem like they're only able to help you manage your health decline with more meds. On the Dr. Kris Life podcast, you'll learn how you can regain your confidence in your health journey. You'll learn helpful knowledge about programs, supplements, peptides, and hormones that Dr. Kris has used with thousands of patients just like you to help them crush their goals and be their best selves. So if you're ready to take charge of your health and are wanting to stay active and healthy so you can be a better parent, partner, or lover, then you're in the right place. Welcome to the Dr. Kris podcast. All right, welcome back to the Dr. Kris Life podcast. We got a great topic today. If you listened to the last episode, we were talking about a specific hair procedure that Dr. Kris was about to embark on, I guess is the word. So, Dr. Kris, you're wearing a cap today.
Yeah, a little unusual. Actually, not unusual. I wear a cap everywhere except at work, of course. I'm a typical Texan. I always wear a cap. But yeah, I'm kind of hiding the little bit of wounds that are still showing from my Neograft procedure, which I don't mind showing. It's really not that bad. You know, I've just got a few scabs, which I was telling you earlier, I can kind of wash my hair, but I can't brush it until tonight. But tonight I actually get to wash and rub off the scabs, which really aren't too bad for being at 7 days.
Well, let's in case folks that are listening today didn't listen to the last episode, let's give a little backstory on this. So you now have a new procedure that you offer at the research clinic. What's it called?
Yeah, so we've partnered with Get Hair MD, which is a large network of providers who are offering hair restoration procedures actually across the country, but specifically started here in the Metroplex and DFW. The company has now spread across the country. And we're offering a wide array of hair procedures from non-invasive FDA-approved laser treatments for improving the quality and thickness of hair follicles, as well as hair care products, and then up to the most invasive procedure, which is the least invasive of the invasive. So I guess let me be clear on that, okay? And that's called Neograft. And Neograft is a machine that performs the FUEs, which is the follicle unit extractions, removing hair follicles from donor sites, which in my case was the back of my head. And then we transplant them into areas where the hair follicles are non-existent, which for me was the receding hairline.
So this uses a device that helps decide where the transplants are going to go. It's not just someone that's deciding to put it in certain locations. Am I wrong?
Yeah, no, not quite. So the actual where it goes is determined by the technician, and that's actually why, and the doctor or the provider, and that's why it's important to have a good doctor and a good provider, because you actually do the actual implants are actually 100% done by the technician. So the machine only does the extractions. So, and there's two different machines that do the extractions. There's one that's a robot based, believe it or not, which is usually more expensive, but can't remove gray hairs, and actually is somewhat limited on the hairs that it can remove. So Neograft typically for the consumer is slightly cheaper, but actually, in my opinion, gives better results. But both the robot and the Neograft are both, the implants are done by the actual technician.
All right.
So then, so before, but I guess let me clear this up. We basically draw in, we make lines and borders and show the patient what we're going to do with the patient. You always want to create a very natural hair border. Even at 50, I don't want to have a 20-year-old's, hairline. That's actually when it's so abnormal that people know it. You just want to fill in those areas to where we look very natural. We look like a 50-year-old male that just didn't lose his hairline. hairline. And because we've all seen those patients, you know, that are people that you're like, oh, that doesn't look quite right. It's kind of like getting your teeth whitened, you know, and you go too white. It's like, no, nobody's teeth is that white. And so you want to pick a shade that's natural, just like hairlines, crowns. You want to make sure and fill it in appropriately.
Okay, so in your case, your hair loss wasn't it wasn't, but it was just normal hair loss to me. You know, obviously it's not as aggressive as mine,
Mhm.
but you were past the point where just the laser treatment would have done you good, right?
Yeah, it was kind of an odd patient because I had a hairline that had receded and had stopped. I honestly don't believe my hairline was receded in the last 4 or 5 years. And then the rest of my hair was actually in really good shape. So the rest of my hair had good density and quality, no thinning, no loss. So the laser, what it's going to do is it's going to help again to fill in areas. It's going to help the quality of the hair, the thickness of the hair follicle. I didn't have that problem. I simply had a receding hairline and those follicles were gone. So the laser's not going to bring back an absent hair follicle. That's asking too much. So I had kind of two options. I could certainly use a laser, and I do use the laser. It was good to prep the scalp with the laser to make sure that you have a fertile environment to be ready for the hair follicles. It's also going to be good for me to grow these hair follicles and keep them healthy. Those are all good things to do, but the laser itself was not going to actually fix my real problem.
So you decided, all right, I'm going to start offering these procedures to your patients, and you thought, you know, I might as well walk the walk. That you were at a point you were like, you could have just not done anything and been fine with it. It wasn't really bothering you, but you decided to undergo this procedure just to be a better provider. No?
Yeah, well, we have a saying in our office that you've heard us say to you off the record is that if we're going to offer a procedure and we're a candidate for it, we're going to do it because we want to be able to show our patients that we believe in it enough to do it ourselves. I just don't feel like it's obviously you have to be a candidate for it. You know, I always joke I can't do vaginal rejuvenation. Okay, I don't have that. But you know, how as a provider am I supposed to make my patient feel comfortable if I won't get it myself? Now, was my receding hairline a big deal to me? No, it really wasn't, if I'm being honest, but I certainly understand if hair loss is a big deal to a patient, especially females. I was lucky enough that it wasn't, at least in my opinion, horrible. But sitting here today, I will tell you, I kind of have a different feeling about it. And now is like, actually, after I went through it, because there was a little bit of, I'd be lying if I didn't say I have a little bit of hesitancy just about the procedure and have seen it but not gone through it. I was like, oh, that's kind of an intense procedure. So now I've gotten through it, sitting here at 6 days, 6.5 days. I'm actually very happy I did it because I know it's going to be something that's going to, you know, improve my aesthetic look. I think I'll be very happy with the results. And so sitting here today, it is something I'm glad I did.
So let's talk about what you expected, and then we'll talk about what you found out that wasn't what you expected. So let's talk about the common things that you expected that were consistent.
Well, so I expected it to be a long procedure, and it was. You know, from start to finish, my procedure was about 6 hours long, and that's a long time. Now, that wasn't, you know, constant. We had breaks, and if I needed to go to the bathroom or uh, of course, if the technician needed a break, we gave them a break. But I didn't in my mind realize how long that really is. You know, every day we work well more than 6 hours. Like, oh, no big deal. It was a long day. So, you know, that's the first thing I would tell patients. It's a long day. You know, you got to kind of mentally prepare yourself for that. We can actually give our patients something to pre-medicate with to kind of take the nerves down. I chose not to do that, A, because I wanted to be able to do videos. B, I wanted to be able to really tell my patients what it was like without that. I needed to work afterwards. So I chose not to take like a Valium or something like that for pre-medication. Although I would probably encourage patients to, because I'm not an anxious person, but I had a little bit of anxiety moving into this procedure. I'm not going to lie and say I didn't. The procedure wasn't nearly as painful as I thought it was going to be. Watching it, and of course I had the patients were telling me, oh, it's not that bad, but you're thinking, they're just being tough, because it was guys that we were training on, and guys have a tendency to, well, they're either really big babies or they're, hiding their real pain. And so I thought, oh God, because, we did 2,000 extractions. So that's 2,000 individual hairs removed, 2,000 put in the head. So that's 4,000 punctures right there, plus, multiple lidocaine sticks into the scalp. So, probably, I don't know, 4,050 sticks for the day. I can easily say I've never been in that realm of, needle sticks in a day or neograft punctures. But overall, like I told you, I think I would honestly put the whole procedure from 1 to 10, 10 being like horrific pain, at maybe a 4.5. And I think I put it at a 4.5 only because it was so long. I think if it was like 3 hours, I probably wouldn't even have it at a 4.5, but it was very tolerable. Our technician is fantastic, really made the procedure, I'm not going to say fun, but, as low anxiety as it could be. Patients are given all the opportunities to take a break if they need to. We extract the FUEs, and then the patient has lunch and just kind of chills for 30 minutes or so, has a bathroom break. So I think the biggest thing that was true was that it was long. And the biggest thing that wasn't true was that it wasn't nearly as painful as what I thought. And then the after part, I really thought that the soreness, tenderness, pain afterwards was going to be pretty intense. 4,000, punctures in the scalp. I can legitimately say I took 2 Tylenols when I went home. That's all I've taken since, 2 Tylenols. And I felt like I had maybe a bad sunburn on my scalp that night. And since then, it's felt more like a rope burn or something like that, but pretty minimal. People look at me and go, it hurts, doesn't it? And I'm like, no, it really doesn't. It really itches. I would probably say the biggest thing is the itching, because you can't scratch the implants. You can't put any pressure on them. My cap is actually putting pressure on my forehead, where my implants are, they're fine. That's probably the biggest thing. And then not really being able to wash your scalp for a few days. As a guy, I wash my hair twice a day. So that's been annoying, which we get to fix that tonight.
So they take those good hairs, good follicles out of the back of your head in this case. And so they had to shave the back of your head.
Yeah. So I don't know if patients can really see, but we had to basically shave it down to a 1 blade in the back. Or if a guy says a high and tight. And I told you the funny story. I was supposed to go to the barber the day before, but we iced and nothing was open. So we just grabbed a pair of clippers and shaved the area where I was getting the transplants done. I get a real haircut though this Friday. So at 10 days, I get a real haircut to kind of even it back out. So I think one thing that's very interesting though is when you pull the hairs, the follicles, they can have anywhere from about 1 to 4 hairs in a follicle. So not every follicle has 1 hair. Some have 2, 3, 4. And when we transplant them or implant them, one of the things that we do is we make sure that we stagger them in proper order. So you wouldn't want to take a hair follicle that has 4 hairs and stick it right in front. Okay, that's going to look very abnormal. You want to embed them kind of in the middle of the field. You want to put those multiple hair follicles further back. Again, making it natural looking. Okay, that's another way that you make sure it's natural. We also make it natural by implanting it at the right angle. Believe it or not, you actually implant them at the angle you want them to grow. Is it back? Is it sideways? Is it forward? If you go and put everything forward, well, now you've got this humongous cowlick, basically. So these are all factors that are part of the procedure, is making sure that we're following the natural contour of the angle of the hairs, making sure that you're staggering those hair follicles properly from front to back, are some of the key. And then also making sure that we draw in a truly realistic hairline, because we all have some recession of hairline as we age.
So in the Neograft procedure, you mentioned something that the robots can't transplant gray hairs.
Correct.
Is that possible in a Neograft procedure?
Yeah, absolutely. The robot just can't, because it needs color to the hair, and you can't just dye it. It doesn't work that way. It's actually picking up the hair follicle itself. And so, yeah, so like one of the doctors came and watched my procedure, and he had gray hair, and he was like, so if I try to go get the robot procedure, and they were like, you can't, you have gray hair, it will not transplant gray hair. But the crazy thing is, gray hair is usually the best outcome of transplanted hair, because gray hair kind of naturally camouflages things. And so people with gray hair are excellent candidates for Neograft, as long as they fit the other criteria. They just can't do the robot procedure.
So I'm trying to think of a situation where the back of your head would not be considered. I guess for a woman, it may be different, this procedure.
So women are no, but it's different. They can hide it. So, what you can do with a female is especially if they have longer hair, like most females do in the back, is you can actually clip it up, expose a small area, shave that small area, remove the follicles, and then she can let her hair go back and cover it. So that a female many times you won't be able to tell from the back that they had a procedure done. Whereas guys, we just typically go, I guess if you had a guy with really long hair in the back, if they had a beautiful mullet, maybe, but typically with ladies, though, that's the nice thing for them is that you can hide those patches where you're actually shaving the head. And also, I had 2,000 FUE extractions. That's about the maximum, okay? And that was because really a lot of people need 2 to 3 procedures. I really only needed 1, but we needed to do the maximum. A lot of patients will do more like 1,000 to 1,250 FUE extractions, because they're going to be repeating it in a year, because maybe in total they need 3,000, 4,000, and you simply can't do that many in one extraction. And so a lot of times they'll do smaller amounts as well. So females, as crazy as it sounds, I think we talked about in the first one, you can even do eyebrows, you can do facelift scars. There's so many things that can be done with FU extractions, or if a lady or a guy just happens to have a bald spot, and an actual alopecia areata, where they literally just have a bald spot, you can go and put hairs back into that area.
All right, so they shave it down. They're taking mostly the follicle and just a little sprout of the hair. And they moved it to the forward places there. Have you seen any growth in those transplants yet?
Yeah, and so how it kind of works from start to finish is the Neograft machine. You basically put it over the hair follicle, hit the pedal, and it basically cores out that hair follicle. It then sucks that hair follicle into a container that is basically holding on to those hair follicles. It counts every single time you do it. So if patients are like, because we charge by the FUE extraction, like, how do you know? The machine counts. Okay, so every single time it counts. And then the technician and the provider are going to remove those hair follicles, kind of sort them into their different, 1, 2, 3, 4, sort of, and then they replant them. After you have to basically create a hole. This is not really rocket science, okay? The angle is important, but you create a hole, and then with forceps, you single-handedly put 1 hair follicle into each hole. Now, to actually see growth, I'm actually going to probably see the opposite. For a little while, the actual little bitty hairs are going to probably fall out, but the bulbs are going to stay in. The actual hair follicle is going to stay in. And to see real, look at my hairline is going to be a 6 to 9 month process. We actually say 9 months. 6 to 9 months, though, is probably pretty realistic, but of course we like to undersell, over deliver. So it's kind of like birthing of a baby. It's going to be towards the end of the year when I start to really see the filled in hairline.
Wow. So I'm just thinking, but during that time you can wash, you can wear a hat, it's not sensitive, you're not worried about degrading the work that was done.
Yeah, so after today, when I'm at 7 days, basically those hair follicle bulbs are healed in. and we're basically a-okay at that point. Literally tonight, I have the okay to scrub off all the scabs that are still there and move on. The only real precaution that we give patients is we say for the next 6 months, if you're out in a lot of sun, to wear a cap. And that's not necessarily for the hair, it's for more for the back of the head, because those, especially if you keep your hair short like I do, especially have blonde hair like I do, those little hair follicles could hypopigment where I had the hair extractions done, and maybe at least through the season cause a little bit of hypopigmentation. So you might see that on the back of the head, because there is no such thing as scar-free removal. Neograft is minimal scarring, whereas, we've talked about before the strip procedure, which is where you cut a rectangle out of scalp and then sew you back together, and you will have a linear scar across. So this is not scar-free, it's minimal scarring, but for the most part, the hair should grow in very densely enough that no one will see any form of scarring, unless you're like my barber and like literally like moving my hair around and looking for a little scar. And a person like me has enough hair density that they can do this procedure in their lifetime about 3 times, but hopefully I should be a patient that should be one and done for the rest of my life. Now, of course, hair care down the road is important, because if you go and, just like a crop for a farmer, you don't just plant seeds and walk away. You of course fertilize and water, and in our case we're going to continue, in my case I'm going to continue using the in-house laser. I'm going to continue using hair supplements, really good serums, and shampoos and conditioners that are all pretty inexpensive, but just to make sure that I'm getting that quality hair down the road.
Well, that's a question that I had. So when I come in later, not me, but I'm putting my place in the patient that this would be good for. Would that person come in and get the laser, sit under the laser thing for a while? Would that help?
So optimally, if we have a patient that is willing to basically do anything possible to make sure that this works out as good as they hope, we would want to do at least 3-4 laser treatments on them before we actually do the procedure. At the same time, we want to go ahead and get them started on the shampoo, conditioner, and the scalp serum, and get them on to the oral hair supplements that we recommend. All of those are pretty cost effective, but get them on all of those products. Again, like our peptide discussions, we want to make sure the body's ready for this, to accept these implants. Now, will they do okay if they just say, I'm here, let's do it? They very well will do fine, but we want to lose as few hairs as possible. We want that percentage of acceptance to be as close to as 100% as possible. And we know that the laser and the supplements and the serums and probably some peptides and all of those things can absolutely help with all of this. So I'm going to be doing everything, because if I'm like, hey, if I'm going to sit through this 6-hour procedure, if I'm going to do all this, I'm going to make sure my crop gets to, successful reaping of that crop down the road. So I've already, this morning before I jumped on here, first when I got to the clinic, I did the laser for 20 minutes. I've already taken my, supplements this morning. And then tonight I'll use my shampoo and serum.
So the peptides that you would use, are they topical or are they injectable?
Well, we could go a couple of different ways with that. We certainly topical, GHKCU, PDD, DBM, or topical over-the-counter hair peptides that could be amazing, or are amazing in different ways for regeneration of hair follicles and quality and thickness of the hair follicles. And then thymosin beta-4, which we've talked about a lot for repair in muscular system, can also do a really nice job of growing hair, but that would be an injection. So, if we were kind of going like, let's go full force, we would use some GHKCU, PDD, DBM topically, along with everything else, and then also using thymosin beta-4 injectable, which I'll be starting on next week as well. The eye storm kind of messed up a couple of things because it just wrecked the delivery. But I went ahead and, like I told you, I simply couldn't wait, because if I didn't do it last week, I probably wasn't going to get it done, because I just have too many things scheduled for the next few months.
So the cap that you're wearing, so tonight you get to wash your hair and whatever. Will you continue to wear that cap?
I guess what I'll make that decision tomorrow on, basically, can I style my hair enough that I feel like I don't look like I just didn't look like my teenage son rolling out, who could care less if he puts a brush through his hair. But no, the plan would be tomorrow to actually ditch the cap. So once I can get the scabs off, I hope to ditch the cap and look a little more normal. It feels so weird wearing a cap at work. Like I said, I wear a cap everywhere when I'm not at work, but at work, it just feels odd.
So these scabs you keep mentioning, are they little bitty scabs?
Yeah, so I mean, over the last few days, they've really, really minimized. And so we actually, for the first 72 hours, we give patients a little spray bottle with normal saline in it. And we actually ask them every 10 to 15 minutes basically to spray the area. And that keeps the scabs soft. It keeps them from adhering as much. It actually keeps the scabbing formation from getting quite as bad. And then at 5 days, which was Sunday for me. So for the first 5 days, you're not allowed to let the shower head hit your hair. Okay. For the first 3 days, we don't want anything, just spray bottle. Then after 72 hours, we allow the patient to put baby shampoo and water in a cup and pour it over the head. At 5 days, we allow you to actually put the baby shampoo on and let the shower head hit, which starts breaking up the scalps. And then at 7 days, we're like, it's on, wash your hair, scrub, get after it. So that for me is day 7 tonight. So I get to go through that process. But just the putting baby shampoo on and then the shower head, my scabs are probably 60% gone already just from doing that.
What about swelling? And there's a lot of places that the skin has been aggravated. Let's talk about that.
Yeah, so I did have issues with swelling. I didn't follow the instructions quite closely enough, and I learned a lesson that I will make sure my patients understand. We do recommend patients wear like a sweatband around basically under where we did the procedure for 72 hours minimum. We also recommend that you sleep sitting up if possible, like in a recliner. I will tell you, I couldn't do it. I could not sleep sitting up. I tried. I was just like, this isn't going to work for me. I wore the headband for the first 36 hours and I told you the story. And that is that I had a podcast or an Instagram live with, on peptides with Dancing with the Stars lady. And I changed my headband to this little headband my daughter wears to hide it under my cap. And it had a negative effect. It actually pushed the fluid down, which then nearly swole my eyes shut. Wasn't painful, didn't hurt. But it definitely looked like a bunch of bees got me. And that lasted for about 48 hours. And my eyes are still swollen. If people know me, if they look closely, they would say you're still a little swollen, but they're about 75% better. And I fully expect over the next 24 to 48 hours, that fluid will be gone. It's not dangerous. It doesn't hurt you. And it shouldn't happen if you actually sleep sitting up and if you wear the headband like I was told to do. I just was a bad patient. Any doctor will tell you the worst patients are doctors. And so I definitely fit that criteria, but it's good. I'm glad it happened because I can really hammer home the point of how let's do these few things and you'll be okay.
So was there any surprise that you didn't expect that was like unexpected?
Not really. Not that was bad. I guess I didn't realize my eyes could swell like they did. That was not something I understood. The technician certainly told me, but I was like, yeah, whatever. They're not talking about anything major, and so, we were doctor technicians, so we were talking a little more informally. And he's like, worst case scenario, your eyes swell. And I'm like, yeah, worst case scenario, my eyes swell. Well, if I'd have realized how much they were going to swell, I would absolutely have figured a way out to make all those things happen. So that's A. But B, probably I was most surprised by the lack of discomfort post-procedure. I really thought it would be worse. Sitting here at 7 days, I would tell patients, if I was getting this procedure done, I'd say, hey, pick a 72-hour window of time that you really don't have to do much. You don't have to get out in the public. You can stay home, you can work from home, whatever. And I really think, like, if you did it on a Thursday, I think by Monday you're going to be happy enough that you can go out into the world and not be looking too abnormal. I think right now, if you don't know me, if I have a cap on, I don't think anyone notices that I had anything done. So that would be my instruction to patients. Pick a 72-hour window where you can kind of hide from life and just relax and recover.
So you're thinking right now, tell us the folks that would be a perfect candidate for this, women and male.
Perfect candidates for this Neograft procedure are patients that have some form of hair loss, but don't have complete hair loss. Okay. Again, and I think that there's certainly going to be patients that show up at our office that are simply too far gone. Okay. You and I joked about it. You would be one of those patients. Okay. You have to have enough donor site to be able to use. So that's A. B, you got to be able to cover the area of hair loss with the donor site. So if you're completely balded, then there's simply, no matter how good the hair is in the back, you're simply probably not going to have enough hair to cover that area to make it look natural. So actual bald spots, alopecia areata or crown hair loss or receding hairlines, simple like a female that has a severe amount of thinning, but still has hair in all the areas, it's just thinning. Those are patients that most likely are going to be perfect candidates for Neograft. But the easiest way is just, we're not going to charge patients to come in and look. Come in and look. Let us peek at you. Let us determine how much hair loss you have. Gosh, if I would prefer them to come in, but if they won't come in, they can email us a few pictures so we can just look at a few pictures and get an idea of laser with Neograft, laser only, or basically we can't help. Okay. I mean, I guess that would be kind of the three pods that you would be in. We can't help, laser only, laser, and Neograft. Patients can do Neograft without laser, although it's not our preferred method, but they certainly can do Neograft without laser.
So some women experience hair loss when they have lupus.
Sure.
Is this something that if they did this, would the lupus continue to make it fall out?
Well, so autoimmune disorder patients are absolute great candidates for Neograft. The truth is that you hope that they get better handle of their whatever their autoimmune disorder is, and that may be areas that we can help in other ways with peptides to possibly help with that. But that may be very well something that the nice thing is if it's typically more patchy with autoimmune disorders, and you probably are getting away with smaller counts of FUE, and that would be something that maybe every few years you come in and touch up. You're like, okay, like my technician, he was leaving, and the next day he was going to do a patient that had a head trauma and actually, had to have a skull surgery, and it created this scar. And he said, like every 2.5, 3 years, he goes in and does a minor transplant to place a few hairs to basically cover the scar. Now, the technician said he doesn't think the guy still needs it, but it makes the guy feel better to have a few more hairs put there, which it doesn't hurt to do that one way or the other. But that would probably be something that would be ongoing potentially, but you could get away because the cost is per hair follicle. And so you would probably have a much cheaper procedure that you could probably, that you most likely could do multiple times down the road. When I said 3 times only, that's like the big one, like I could probably only in my lifetime do 6,000 FUE extractions, because you have to remember when you pull that hair follicle, it's not coming back. It's gone. We don't produce new ones. Okay. It's gone. And so I have nice dense hair, but if I keep pulling, then eventually I'm going to have basically thinning on the back of my head, which I don't want. I don't want to create one problem to fix another.
Yeah. All right. Excellent. Is there any last comment you want to make on this? Before we tell everyone how to connect with you and check this out on there.
No, I just want to basically tell everybody that we're going to continue to show the progress through social media. We'll probably do like a monthly checkup with just how things are going. Obviously, my patients that know me, they can come in anytime and stare at me if they want to. I'll be glad to show them my head and talk about my experience. Anyone that's ever come to my office knows that we're not a high pressure sales facility. We just talk about our experiences and what we can do to help patients.
All right. And so folks that want to set up a time to maybe chat with you about this, what should they do?
I think the easiest route, you could call 817-599-9902, but probably the easiest way is just use our website, theresearchclinic.com, and hit one of the consultation buttons and just put in your info, and someone usually the same day, which is usually Lauren, my virtual employee, who will reach out to you and talk to you and get you scheduled, answer questions, get you scheduled, come in for a free consultation. And again, we're a non-pressure facility. We'll just basically tell you what we can or can't do and how much that costs. And then you can think about it, make your decision, and proceed with whatever works for you.
All right. And that's theresearchclinic.com. Schedule a consultation. Dr. Kris, another good conversation. You're not going to watch the Cowboys play the Super Bowl this weekend, right?
I guess just in my head, maybe. The good news is we'll be in Vail this weekend for an IV conference. So I guess I'll just have fun in Vail and don't worry about it.
All right. Well, have fun in Vail. We'll see you next week on the Dr. Kris Life podcast. And that's a wrap. Thanks for joining the Dr. Kris podcast. If you learned something today and you want to connect and get more information, visit our website, www.drkris.life, where you can find more great information or even schedule a time to learn how you can engage with Dr. Kris. Be sure to follow, like, share, and we'll see you on the next episode of the Dr. Kris podcast.